Hello everyone, my name is Jason Roberts. I'm from the University of Queensland, Royal Brisbane Women's Hospital, as well as the Hurston Infectious Diseases Institute, and it's an absolute pleasure to welcome you all to this very exciting microsampling symposium, which has been convened by Dr. Suzanne Parker, who will be our first presenter. So it is wonderful to be part of these kind of events, particularly with the faculty that's present and the wonderful expertise that they all have. So it's wonderful that so many people could be joining us online. As many of you will know, we record all of these presentations and have them uploaded to YouTube such that the attendees, or alternatively other researchers, clinicians, people that are just generally interested in the area or have trouble getting to sleep, are able to just find those presentations and review them into the future as well. So I wanted to just talk a little bit about the education program that this microsampling symposium falls within. So it is run by the Centre of Research Excellence, Reduce, which is a centre that I'm very fortunate enough to lead, and we've been running this education program since 2016. In the last 18 months, we've had 13 different events that have been conducted, and we have more planned for the rest of 2021 and into 2022 as well. And so it's an absolute pleasure to be able to convene many of these different events and then to react to some of the feedback that we get from our collaborators and colleagues about information that they would like to learn from other experts in the field. And so we also welcome feedback from you, the participants and attendees at tonight's webinar, that if you have any feedback you'd like to provide to us and suggestions for webinars and meetings into 2022 and beyond, we'd be very happy to receive those. So over the last 18 months, as I mentioned, that we have held 13 different events, and across each of those we've had in total 3,500 people that have attended those, which is something which we're very proud of, and those people come from over 40 countries. In the context of all of the educational programs that we have conducted, this has led to 136 videos currently being uploaded and available on YouTube, and so that's a really nice library of and resource for people that are interested in all aspects in and around antimicrobial dosing, pharmacokinetics, microsampling, sepsis, and all related issues. It's a pleasure for us to be able to make those available to all of you. Of course, one of the reasons that this is very important for you to be aware, of course, is that we can't do this without our sponsors, and we have some wonderful sponsors that we're very grateful to, who make this education program. Our key partners in this regard are the University Hospital in Nîmes in France, which has been a long-term collaborator of our research group, and they support all of our educational activities, and we're very grateful to them for their continued support of that. We're also very grateful to Pfizer, MSD, Gilead and Baxter for their brilliant support over recent years, in particular in 2021, whereby it has been quite difficult to arrange some of these educational symposia, and it's because of their fantastic support that we have been able to do this, and so we remain indebted to them for their support. So tonight, there's no exception. You can see the program on the screen in front of you there. We've got speakers from 3 different continents. Each of them are fantastic researchers. Some are clinicians, some are scientists, and generally provide a wonderful expose on the expertise that there is in microsampling around the world, and for us to try and understand some of the efforts that are being put forward to allow this very interesting method be something which could be advanced into more feasible usage in various different areas. Of course, the focus of this particular seminar is on the application of microsampling for therapeutic drug monitoring of antimicrobials, but there is also many different other applications of this as well, and this can extend to use of microsampling for therapeutic drug monitoring in various patient populations, as will be discussed here. Also, microsampling as a means of performing therapeutic drug monitoring for longer term drugs that may be used in the community and that require constant dose optimization because of the narrow therapeutic window. The use of microsampling in the context of toxicology studies, be they in preclinical animal models or forensic toxicology, that's very important. And then in pharmacokinetic studies as well, be they preclinical or clinical pharmacokinetic studies, different patient populations, microsampling really could revolutionize our pharmacological understanding and use of drugs into the future. And so, we're really glad that we've been able to bring this panel together and this faculty of excellent speakers, leaders in their own right, to learn from them about microsampling and what the current state of play is. So I'd now like to move on and introduce our first speaker, who is also going to be the chairperson for this evening and also the moderator for the question time. Now, before I go forward, I recognise that there's no ideal time on an international clock for us to be holding one of these events. It's bath time in my house, so there's lots of noise going on in the background. I realise that people in the US are probably trying to sleep and trying to work out whether or not they can wake up for this event, and those in Europe and throughout Asia are in the midst of their days or trying to make time for this as well. So we are grateful for your presence. But Susie Parker is the person who's made this possible. And so we're very grateful to Susie. She's a research fellow at CRE Reduce, which is at the University of Queensland in Brisbane, Australia. And she is a fantastic resource of ours. You can see that there's a very nice biography of Susie there. The best compliment I could pay to her is that she is really a fundamental member of our research group. We have a very, very good research group that I'm very proud of. And without Susie, we would be nothing like what we have turned out to be. So Susie is a fantastic bioanalyst, pharmacometrician, as well as someone who's starting to make an impact in the clinical area of clinical trials as well. And we're going to hear some really interesting research from her tonight. And even though I work with her, I'm looking forward to hearing what she has to say. So Susie, I'll hand over to you.
Thank you very much, Jason. That's very kind of you. I'd also like to thank everyone for coming along and joining us this evening for our microsampling symposium. And I'd particularly like to thank our speakers this evening. And I appreciate the time you're taking out to present your research and also to work with us and as we come together as a community of people who are sharing this, this research interest. We've got, as Jason said, we've got people coming from across the globe this evening to present. We are starting in the University of Southampton with Dr. Dan Owens and Dr. Dave Rowe, who will present shortly, talking about bedside measurement for therapeutic drug monitoring. We'll move to Belgium with Professor Christoph Stover, who works with microsampling in forensic toxicology. We'll then move to the University of Sydney with Professor Jan Willem Alphenaar, looking at microsampling in rural and remote settings. Pop into Brisbane and we've got Dr. Tavy Dorofaf, who will be describing some PK studies he's working on with microsampling. Dr. Adam Irwin will be presenting on neonatal TDM using microsampling. And then we'll end into the US, where hopefully they'll have had time to start their morning. And we've got Associate Professor Ganesh Murthy presenting from Children's Hospital of Philadelphia on some vancomycin microsampling that they're using for capillary and venous samples. So we've got a busy evening or day or morning, depending on where you are. And with the way we'll run is we'll have a presentation, and then if you have any questions you'd like to address to the speakers, if you'd like to pop them into the chat, I'll follow up with the speakers after their talk, and then there will be another opportunity for question and answers at the end of the evening if you're able to stay with us. To have an opportunity to talk about establishing a microsampling network, and if that's something that is of interest to you, we can discuss that at the end of the session. If you're not able to stay though, feel free to email me if that's an area of interest to you and you'd like to join us. Collaborative research with microsampling forward. But for now, I think we'll get started,